gatherings that have occurred in people's homes, on people's porches, parties, sleepovers, weddings, those type of things that we really, want to be concerned about. But it's not just here locally. We're obviously seeing it statewide. Governor Wolf and Secretary Levine the other day talked about a path that if not slowed down or stopped, we could be statewide having 22,000 cases per day. We're about 10% of the population in Allegheny County. That would mean we'd have over 2,000 cases a day if you followed the average. And obviously that's something that would be very, very detrimental, as hospitalizations go up, and we see hospitalizations that have gone up, and in some places they literally can't handle the capacity right now. We don't want to get to that point. Also, for the first time in months, the U.S. went over 2,000 deaths yesterday. Again, these are numbers that we were hoping we would never get to, and now they're here. And what are we going to do? Well, we've got to be responsible. We've got to be wearing our masks. We've got to be keeping social distancing. And again, we talk about at work, at school, in functions that are official functions. People are following the rules. When they go to the grocery store, they do stand 6 feet apart when they're in line. It's the informal things that are happening. I know tonight's one of the busiest nights where people get together, and the governor put an order in that I think, he's certainly drawn a little bit of criticism, but I think this governor's on the right track, and I'm going to give you some numbers that really matter. In Pennsylvania, the CDC just put these numbers out. As far as fatality rates go, we're like in the middle of the pack. 0.6 fatalities per 100,000 population over the last 7 days. Compare that to South Dakota, where they have a very irresponsible governor who has literally gone against science and against everything. They're at 2.8 deaths per 100,000 people over the last 7 days. 4 to 5 times what we have here in Allegheny County in the state of Pennsylvania. We don't want to go there. And we don't, because we got people that are cooperating, we have people that are working together, we have people that are listening to the advice that our medical professionals, that whether it be Dr. Bogan, Secretary Levine, Dr. Fauci, are giving us. And we want to continue to try to work through this, because we're hearing, that the vaccine is close at hand. We're hearing that possibly there could be distribution of some vaccine as early as the middle of December. So, I've used this sports analogy in the past. I'm going to use it again. We're in the red zone. As Steeler fans, we know what that means. We're on the 10-yard line. So we just have a little more time to go. We just a little more vigilance from from our families to our friends to all of us who know what we need to do. And certainly this weekend, be safe, be responsible. Again, we need to come together by staying apart and doing our thing. So let me turn this over to Dr. Bogan to give the weekly report, and then obviously answer any questions that might be coming. Thank you. Dr. Bogan?
Good afternoon. Thank you for joining us on the eve of what I hope will be a bit of a respite and an opportunity to reflect and give thanks. It has been a challenging couple of weeks, and I'm not sure when things will be getting better. The coronavirus continues to spread through all parts of our community. It's everywhere, and it's affecting everyone. We had a grim reminder of that this week with the reported death of a young child. Sadly, nearly 500 of our family, friends, and neighbors have succumbed to COVID-19 since March of this year. About 50 people died in both September and October, but thus far in November, we've already reported 64 deaths. And modeling predicts that we will lose more members of our community in the coming weeks and months. And I'm again asking you all, everyone, to help stop the spread of the virus in our community. As the county executive said, the people dying aren't mere numbers. They are our fathers and mothers, grandparents, brothers, sisters, and children. They are friends. Each is an important member of our community. Hospital admissions are climbing rapidly as well. To give you a sense of that, in September, about 30 county residents a week were admitted to the hospitals. In October, that number rose to about 55 residents a week. In the first week of November, that number rose to 98 per week. And 162 were admitted the second week of this month. And we're still gathering data on the rest of the month, but these numbers will continue to climb. These numbers put strain on our hospital staff, and they also reflect the suffering of our county residents. So again, it's been a hard couple of weeks. The sheer number of cases reported over the last several weeks has taxed our team here at the County Health Department, our team of case investigators, as they work to keep up. They're working into the night, 7 days a week. They haven't been able to reach every case and are spending less time on the phone with cases that they do reach. Under ideal circumstances, a typical case investigation takes 30 to 60 minutes, and sometimes even a little bit more. But with more than 2,600 cases 2 weeks ago, more than 3,600 cases last week, and already 2,000 new cases reported this week, our investigators cannot spend enough time to reach everyone on the phone, and they can't spend much time with each person they do reach on the phone. So in response to this rapid increase in cases, we started a new approach. Investigators talk to new cases about isolation procedures and then direct them to a secure, confidential online form to complete the rest of the investigation. And this has enabled our team to reach more cases faster. However, even with that, not everyone will be reached. If you tested positive for COVID-19 between the dates of November 6th and November 22nd, and you have not yet received a call from a case investigator, you likely will not be called. Even though you've not been called, if you tested positive for COVID-19, you must follow isolation guidance. Isolation means staying away from everyone, even members of your household. You should isolate for 10 days after you first experienced symptoms of COVID-19, or 24 hours after your fever goes away, if you had one, and your other symptoms improve, whichever is longer. So 10 days is the minimum. For example, if you first notice symptoms like cough or loss of taste or smell today, you need to isolate until at least December 4th. And if on December 4th you still have symptoms, you should continue to isolate until a day after your health begins to improve. If you never had symptoms but tested positive, you should isolate for 10 days starting the date you went to get tested. And if you have not been called by our case investigators, we're asking you to start the contact tracing process yourself. That means reaching out to your close contacts who you may have exposed to the virus starting 2 days before you had any symptoms or 2 days before you got your test. A close contact is someone who you were within 6 feet or less of for more than 15 minutes with or without a mask. Ask your close contacts to quarantine and get tested. Quarantine means staying away from anyone outside your household, and they should quarantine for 14 days since the last time they were exposed to you. And one more thing. If you tested positive and completed your isolation, you do not need to be tested again. After you've had COVID-19, you can test positive for up to 3 months after your infection, even though you can no longer spread the infection. And finally, again, it's been a hard couple of weeks, but I want to take this opportunity on the eve of Thanksgiving to reflect and give thanks to the staff of the Allegheny County Health Department who have worked tirelessly since this pandemic started 8 months ago. I also want to give thanks to the many county departments that have helped in this COVID response, including Human Services, Emergency Services, the county executive and his staff, and the county manager's office, among others. I also want to thank our healthcare workers who continue to put themselves on the front line of this pandemic every day. Thank you to other frontline workers who have kept our essential businesses up and running and kept food on our table. Thank you to the school administrators and teachers who have put our children's education and safety first. Thank you to parents who have had to take on way more than parenting over the last several months. And thank you to each of you, the residents of Allegheny County, who have made choices to keep yourselves and those around you safe. Thank you to everyone who has changed their Thanksgiving plans to prioritize staying at home, and to everyone wearing masks and keeping physical distance. We can get through this if we continue to work together as a community. Just a few reminders. The McKeesport test site will be closed tomorrow and Friday, but will reopen testing on Monday. The site expanded its hours to 9 to 5 to accommodate more appointments. I know testing options have been limited over the last few days. If you need a test but can't get one, I ask that you stay home and stay away from others until you're able to be tested. Our case investigation and contact tracing teams will be taking tomorrow off, so do not expect a phone call from the health department on Thanksgiving. There also won't be a daily update tomorrow. We will issue an update on Friday with both Thursday's and Friday's information. And with that, I ask you to please stay safe and be kind and have a happy Thanksgiving.
The first question today is from WPXI. Given the level of community spread and the lack of cooperation with case investigators, is contact tracing still an effective way of managing the virus?
So a couple of weeks ago, I talked about boxing it in, which really requires us to reach people through case investigation first and to identify their contacts second, and to ask everyone who's sick or possibly going to get sick to stay away from other people. That's boxing it in. We have been, up until a couple of weeks ago, reaching most of our cases and most of our contacts. The more we can reach, the better we can do that. But as I said in my comments today, just because we can't reach everyone doesn't mean we can't, as a community, stop the spread. And that means you out there need to do it yourself. Follow the guidance. We have lots of great information on our county website, on the CDC website, the Pennsylvania Department of Health website. And if you need information because you don't have access to a computer, you can call 211 and they will provide you the best guidance. I'm optimistic that we can do that, and we need your help. So we can't do it without people's cooperation, and that's it.
This next question is from WTAE. Do you sense that the message about the danger of the recent surge is getting through?
I hope so. We've been trying hard. I know many organizations have been trying to really message this as well. It really has to get out there because we need to really slow down the spread of our cases in our community.
This next question is from the Post-Gazette, but there are similar questions from other outlets. What did you think of the decision by the NFL to postpone the Steelers-Ravens game? Were you concerned earlier Wednesday when it appeared they were going to go forward with the game despite so many COVID cases on the Ravens team?
So those decisions are really made by the NFL and the rules that they've been following. And I am actually going to make a little pun, but I'm going to punt this one to the state.
This next question is from WESA. Do you still believe that most people are contracting the virus at small private gatherings, or do you think the pattern of transmission has shifted?
The pattern of transmission really is when people get close to one another, take their masks off, and spend time together. And that can be in the lunchroom at a business. It can be at a wedding or a party or an event. In general, like I said, we don't see much spread, for example, when children are sitting quietly in a classroom doing their work together. We see it when you bring people together and you take your masks off. And that happens in restaurants and in bars, in the break room at rooms, at weddings and at funerals, at birthday parties, at those kinds of events. And that has continued to be what we learned from our case investigations.
This next question is for the county executive from the Post-Gazette. What kind of reaction are you hearing to both the county's advisory last week and the governor and secretary's order and advisories this week? Is it as angry as the lockdown orders from the spring?
Depends on who you talk to and on what day. We know these are very, very difficult decisions, whether the state is making them, whether Dr. Bogan is making them, but they're done very judiciously and with a lot of study and a lot of thought that goes into there. Not just done, willy-nilly at the drop of a hat. So what Dr. Bogan talked about, the dangerous activities are when people take their masks off, are sitting around together, are talking, and are close together. So when the governor gives orders about tonight and the 5 o'clock curfew, when it comes to alcohol, he's aware that this is one of the busiest, if not the busiest night of the year in many places where people come together. And when you add alcohol into that mix, people often lose some of their inhibitions, they lose some of their thought process about staying awake, the mask comes off, all those kind of things. So certainly some people are not going to be happy with that. With that. When Dr. Bogan gave the guidance last week, the very strong advisory, I'm sure there were some people that want to shut everything down, that think that that's the way to do everything, to just shut everything down. There's probably other people that think, well, just keep going, just leave everything open and people will be fine and people have the freedom to, do what they want. The problem with that is the freedom to infect other people is not a freedom that we appreciate and we talk about. I mentioned numbers before, and I know we talk about a lot of numbers. Dr. Bogan does and I do. And I don't often talk about individuals, but I'm going to mention an individual that we lost on Monday who is very well known. A young man, an older man, I guess, a guy by the name of Clifton Pitts. Clifton was the director of the Mon Valley's People Action Committee, and Clifton was one of those folks that everybody in the Mon Valley knew. Clifton was very active politically, certainly got active during campaigns. He would always have a big rally in the valley, he called it, every year. Didn't have it this year for obvious reasons. But he kept going out and campaigning. He kept going out, delivering signs. If you drove down 837 through Duquesne and Clairton, you would see a lot of signs. There were probably signs, political signs, that Clifton Pitts would have put up. He touched a lot of people for many, many years. During his going out and seeing people during October, Clifton contracted COVID-19. He was always wearing his mask, but not necessarily everybody that he came in contact was wearing their mask. And he got COVID, and on Monday, he passed away. Clifton is one of those people that is not just a statistic. He is somebody that touched a lot of lives and is going to be sorely missed. Clifton Pitts was somebody who did a lot of help for a lot of people, and a lot of people were obviously very sad when someone of that nature who knew a lot of people and people touched was lost. But in those 2,000 people that died yesterday across the country, and those 100 people or so that died a couple days in our state, there are stories like that of husbands and wives and sons and daughters and grandparents, etc. This is a very serious, scary disease that has taken over 250,000 people. Again, numbers start to, overtake us, but when we think about it on an individual level, people that we know that have gone through this. Dr. Bogan mentioned an infant, a young child. Obviously, that touches us in a different way. So there's always going to be controversy on this. Was enough closed? Was too much closed? These decisions are not made easily, but we've got to somehow bend this curve, lower this spread. Otherwise, we're going to have much more fatalities. More people that we love are going to be missed. Our hospital systems will be overrun, and we'll be in much more dire circumstances.
This next question is from WPXI. Has Allegheny County been given any indication when a vaccine will be available and what role the county may play in distributing it?
Sure. So there really is a national effort on the vaccine front. And so what I've heard from calls with the CDC and with the State Department of Health is that probably there'll be some vaccine being distributed as early as the middle of December. The first shipments of vaccine are going directly to our healthcare systems to vaccinate our healthcare workers and our healthcare workforce. That vaccine will come in over December and hopefully January, and then the next shipment of vaccine is going to go to pharmacies to vaccinate our long-term care program. I don't expect to have vaccine until as early as maybe late February, beginning of March, coming to me at the county and to other healthcare providers in our community. We are working on a pretty aggressive and ambitious plan to distribute that vaccine very widely. And we will follow the guidance put out by the CDC, the Pennsylvania Department of Health, and the ACIP on how to prioritize those vaccines. But it's going to take a long time to vaccinate everyone, and we'll be as efficient as we can, working with lots of community organizations, our federally qualified health centers, our faith-based groups, and others to really reach our community broadly and effectively.
Thank you. This next question is from WESA. Hospitalizations continue to increase. Is there a point where you project that our medical systems in and around Allegheny County could become overwhelmed with COVID-19 patients?
We've definitely seen overwhelmed hospital systems across the country. We're very fortunate here in Allegheny County to have a very robust healthcare system, which all of our healthcare providers and our hospital systems have extensive planning to expand bed capacity as needed and ICU capacity. What I worry about much more closely is the staffing of those facilities. So they and us, we're all watching carefully. Again, as we have more cases in our community, our healthcare workers are impacted. They have to stay home with sick family members who are quarantining. Again, it's sort of a ripple effect. So again, the more cases we have, the more challenging we will have at staffing all of our healthcare facilities. So I'm not particularly worried about bed space or ICU capacity or ventilator space. I just want to make sure we have adequate staffing, and that means reducing the numbers of cases we have in our community. The other thing we have a real advantage of in our community is we have an incredibly cooperative group of healthcare organizations that are working together every week to discuss how things are going, do they need to change things, and we are watching that closely. So again, all of the region's hospitals have been incredibly cooperative and working together. So together, we'll address any challenges that come this way.
This next question is from the Pittsburgh Business Times. How has the difficulty in getting responses to the case investigators' questions been impacting the data stream and the decisions on mitigation efforts? Do you have enough information on the spread of COVID-19 in the community to be able to make decisions?
So I met yesterday with our lovely group of we call them our case investigation leads, and they shared with me their experience with calls and with supervising their other case investigators. And to be honest, we do reach enough people, and I asked them sort of what percentage of people do you think are really cooperative and what are really challenging? And they said over 95% of people they reach really are cooperative and helpful. They do have occasionally the people who are challenging, but again, it's really a minority of people who aren't. And they do get really good information. So right now we're certainly getting enough information. And interestingly, we've been getting a lot of the forms completed that we email to folks, which has been fantastic. So we get those forms and we get a lot of information from those forms as well. And that has helped us to keep a really good stream of information coming our way about our cases.
This next question is from the Post-Gazette. Do you think that the governor and secretary's orders and advisory this week will have an impact on case counts, hospitalizations, and eventually deaths from COVID-19?
So mitigation orders, we know, have had an effect in the past. They've definitely worked. It takes a while for those effects to be seen. So again, we probably wouldn't see an impact for the next 2 weeks at least on those effects, but I'm optimistic that if people actually adhere to those advisories and guidances, they will have an effect. We know they've worked in the past, but it really is reliant on everyone out there who's listening to please follow those guidances. So in 2 weeks I can come back and say, guess what? They worked again.
This next question is from WTAE. What is the county government, doing to stop the Steelers-Ravens game Sunday from becoming a super spreader event? There are a lot of concerns. Obviously, fans are looking forward to the game, but now it's on Sunday. Was that the right call? And how do we ensure that it doesn't become a spreader event?
Well, again, should I punt this one also to the state?
Let me jump.
Oh, good. Oh, good. I'll punt it to Rich Fitzgerald.
Fair catch, right?
Good catch.
These, again, are difficult decisions. And I have to say this, and not just as a Steeler fan, but to my fellow Steeler fans. I thought the Steeler fans over these last number of games, and I'm not sure how many games there have been since they've been back in Heinz Field, have been extremely diligent about following the procedures. I haven't been to any of the games, but I've certainly watched them on TV. And when they show the fans, they're spread out, they're wearing their masks, they're adhering to all of the guidelines that the CDC and Dr. Bogan and our medical professionals have given to us. And again, what we have learned throughout this pandemic is when people are following the guidelines, the spread doesn't occur. Dr. Bogan mentioned about kids being in school all day long. They're wearing their masks, they're spread out, but it's after school when they go and hang out with their friends and the masks come off, et cetera, et cetera. So I'm not sure what the guidelines will be now that we've got, cases really going very high again, statewide as well as locally. But regardless of all of that, again, if we've got to not go to a game or a game or two between now and the end of the year, but we're getting near the end where we can keep people safe, that's what we want to do. Again, using that parlance, we're in the red zone. The vaccine is coming. It's been approved. Two of them are going to be here. And as Dr. Bogan said, we're going to do everything we can to get them out to people, get them distributed, get people safe so that we can all get back to a normal way of living. But we don't want to lose more people. We don't want more people hospitalized. We just got to continue and hang in there just a little more.
I'm just going to put one more plug in, which is it's not, again, that the games are outdoors. What I'm worried about are the Steelers parties in people's homes. So again, just remember, small gatherings, masks on. If you are eating, separate far apart. So it could become a super spreader event if everyone in the county were having huge parties in their house with the Steelers game.
This next question is from WESA. We also have a similar question from WTAE. Most of the universities in the county don't plan to have students return to in-person learning until late January. Do you recommend they have students tested or shelter in place when they do return to Pittsburgh after break? And for those who are going home, are there recommendations for parents about what they should do? Should they be tested as a matter of course as they're coming home for the holiday?
I'm going to do this sort of separately. The first one is about when students return. I'm going to remind you that our universities here did an incredible job. We did not have huge outbreaks in our community setting. We had very low numbers. And every university had their own plan because every university has a different population of students, dormitory settings, et cetera. So I trust, just like they did an incredible job in the fall, that they will do just as an incredible job, and they probably even learned more from that experience and will do even better. Testing may be part of their plan, but it may not be. I leave it really up to them. They've done an incredible job. As for parents and children returning to their homes, just remember, 40% of people who have this virus have no idea they have it because they have no symptoms. So you have to take this individually as parents and children together, knowing on the risk factors of people in your home. There's a million factors that go into how you manage this in your home. But if you understand how the virus spreads, that many people have no symptoms, and the behaviors and the risks that people have had before they came home, you should be able to make a good informed decision. And again, it has to be individualized to your home and your family.
This next question is from the Pittsburgh Business Times. When do you think you'll be able to resume more full case investigation and contact tracing? And are you concerned that the changes to case investigations and contact tracing means that you might have an impact on the spread of the virus in the county?
Yeah. Good question. And I'm again, our transition to using this online form seems to be very effective for most people. And as we continue to see how we roll that out more efficiently, I hope we can get on to the point where we can reach almost everybody. But our numbers, if they stay at 500 or 600 a day, it's going to be hard to do. Is a public safety alert coming through from the state?
So everybody says just
I got one
all
too,
across
yeah.
the entire state.
Okay. Sorry, a little startled there.
Do you want to read it? Let me read what everybody
Please,
just
please,
got on their
please.
phone. What everyone just got on their phone. Public safety alert. Oh, I just lost I lost it. It basically said COVID. I don't know why I left my phone. In PA, COVID-19 rates are rising and hospitals could soon be at capacity. Stay home if possible. If you must go out, maintain social distance, wear a mask, wash your hands for 20 seconds, Stay up to date on the spread of COVID in your community so that you can protect your loved ones with the COVID Alert PA app. Isn't that appropriate that in the middle of this, everybody in the state got a, so anyway, so sorry, Dr. Bogan.
No problem. All right.
That actually leads to a follow-up question from WTAE, which was, how do you convince people to sign up for the state's contact tracing app, and why is it important?
The app is important. It is just one, it is not the only thing, but it is part of the tools in our toolbox, right, to be able to reach people. I report in every day on the app, and I use it every day, so I encourage other people to do it. I think just letting people know that it is a highly, really the state went through many iterations of what kinds of app to use, and they went on it based really on security and privacy, and to just reassure the public that this is a really secure and very private app that doesn't share information, and when used by a lot of people will help us in this time of need. As our cases go up, it's even more and more important.
And I apologize, I want to return to the question from the Pittsburgh Business Times. Again, it was, when do you think you'll be able to resume more full case investigation and contact tracing? And will the changes to that impact the spread of the virus here in the county?
I think I was starting to say, you know, across the country, many places have given up completely. We have not done that. And again, we're trying to get to full case investigation, but using this alternative strategy. The form that people fill out gives us the key information we need. So thank you all who have filled it out. We are not behind on contact tracing. We have been able to keep up. We have plenty of contact tracers. We use a combination of volunteers through our Medical Reserve Corps. We're using staff from the federally qualified health centers to help us with contact tracing, and we have staff at the health department as well. So we've never fallen behind with contact tracing. Our issue really is case investigation, and I hope if the cases can go down a little bit and we can get caught up, we can do a reset and do more thorough. But that is the challenge that's happened in other communities, right? So we are just sort of catching up to other places. And it does have an impact. We know that from years, the way to box in an infection is through case investigation and contact tracing. So we would love to get back to it as soon as possible. I don't have a prediction of when that will be.
And that was the final question.
Oh, well, I wish you all a very quiet and peaceful Thanksgiving.
Thank you, Dr. Bogan, and again, thank you for your team and the folks that are working every day. Would they have at least one day off tomorrow to spend a little time with the people in their households? I know they won't be able to spend time with extended family because of this year's mitigation that we're going to be dealing with. You know, we're getting close, and you know, it's been 8.5 months since we've been dealing with this, and you know, we've gone through kind of waves of this. You know, back in March, April, and May, when the mitigating and a lot of things were shut down, you know, we were able to keep our numbers very low, and then we relaxed a little bit in early June and throughout the month of June, and then those numbers started to rise again, and then there became very strategic mitigating factors that we worked on. And then again, everybody came together, and then in July and August, and even during the challenging times when we knew school was coming back, as Dr. Bogan said, our universities who have done such a great job in our school districts as well, and with sports and things opening up at the end of summer and early fall, there was a big concern. But the numbers in September still remained low. We did pretty good, and then even in October, they continued to remain relatively stable. And then it's almost like we relaxed again. And around Halloween, things started to get out of control. Halloween parties, sleepovers, end of year banquets for sports, et cetera, et cetera. And obviously we're dealing with this now in November, and we're seeing numbers that we've never seen before. And we need to, again, go back to where we know what we need to do. We need to be vigilant. We need to protect our families. We need to protect our neighbors, our friends, and the folks that we care about in this community. So again, please follow Dr. Bogan's advice, Secretary Levine's advice. They're telling us things for the betterment of all of us, to keep our economy open, to keep as many things open as we can. And we can do that if we follow the guidelines of wearing the masks, keeping social distancing, and not relaxing on the weekends and at night. So again, want to wish everybody a very happy Thanksgiving and a safe Thanksgiving. And hopefully with the vaccine, next year at Thanksgiving, we'll be able to be back to normal.